Hello, good afternoon. My name is Dr. Chudi Ufundu of Snowspirations Global Health Solutions. Thank you and welcome to our Tuesday Open Clinic with Dr. Chudi Ufundu. Now, this clinic is going to concentrate on the realities and the risk involved in becoming pregnant from age 20 up. So within that age bracket of, once you graduate to 20 before you enter 30, what are the realities? What are the facts? What are the risk factors that might come up if you happen to become pregnant in your 20s? Very important catchment area in reproductive phase. So when you come in, please confirm you can see me clearly this evening. Confirm you can hear me. Once we have an appreciable number, I'm going to start. Now, you have to understand that a woman has different chances, different potentials of becoming pregnant, of having good outcome, of having complications, depending on your age. So if you happen to be pregnant early, let's say you became pregnant in your teenage age, so probably from 13 up, which is very rare lately. Previously you will see a lot of people that will become pregnant very early. It's not advisable to allow young girls to become pregnant early. The reason is because in as much as they can become pregnant anytime they start bleeding. So any lady that starts bleeding can become pregnant, but their reproductive organs are not fully developed. So you see situations of young ladies going into sexual practices, most times abusive, and getting prone to a couple of issues, including VVF, vesicovaginal fistula, and including RVF, rectovaginal fistula. So these are things that can happen when the reproductive system in the girls are not fully developed. But we are talking about women that are ready in their 20s. What are the realities? What are the expectations? What are the risks involved in becoming pregnant if you're in your 20s? Now, guess what? Reproductive rates is actually going up. So we've seen so many women trying to become pregnant later in life because of modern technologies. But generally, when we spread out the reproductive potentials for women, the healthiest and the easiest period to become pregnant is in your 20s. So women that are in their 20s right now, if you're in a relationship, a very cordial, friendly relationship, maybe you're married, maybe you're doing your fiancé and fiancée, or maybe you're whatever you're doing and you want to have a baby and you're in your 20s, this is the best time, the healthiest time, the time you will have less complications, the time you will blink and you become a mother. The best and the healthiest and the easiest period to become pregnant is in your 20s. So from 21 up to 30, very easy. It goes like, sunlight, very fast. Now you have to understand that in as much as it's easy to become pregnant in your 20s, there are still some percentage of women that have infertility. So if you're in your 20s and you're in a legally, mutually desirable union, so that means you're in a relationship where you're desired and you're loved and you're cared for and you're making love. If you are trying to become a mother and you're in your 20s and you are doing the right thing. So what is the 3 right things you have to do if you want to be a mother in your 20s? You have to pray every day. Then you have to make love. Now, you might not necessarily need to make love 48 hourly. The reason is because you have virtually all your eggs in good place. Predictable menstrual cycle. So if you're in your 20s, you can comfortably know if you bleed every 28 days, if you bleed every 25 days, if you bleed every 30 days. The normal range is 21 to 35 days. So in your 20s, you should pay attention to your body. Now, in your 20s, if you bleed every month, possibility you ovulate every month is high. Possibility you still have very good high number of quality eggs, it's high. So if you bleed every month and you can predict your cycle. You can predict your ovulation. You can predict your fertility window. So you can know when you can become pregnant, or you can know when to avoid pregnancy. So this is easy because you are still younger. Now, by the time you start heading into the 30s, 35, it begins to dwindle. So if you are blessed to be in a relationship where you're desired and you desire your partner, the best time to have your kids, if you can, it's in your 20s. Now, also a good advantage. Women in their 20s will have fewer chronic medical conditions. So in your 20s, the possibility your BMI will be within normal range is there. The possibility you don't have diabetes is there. The possibilities you don't have hypertension is there. So you have fewer medical problems in your 20s. So your pregnancy will also be fewer in adverse effect or side effects or complications. So complications are fewer if you become pregnant in the 20s. Now, I'm saying this based on scientific medical perspective. Now, the reality on ground, most women in their 20s might not be matured to start having babies. The problem in the society is babies having babies. The possibility that in 20s, you might still be living with your parents. You might not have a good job. You might still be in the university. You might still be looking for education. You might not have a source of income. It's very high, depending on where you live, depending on your orientation. Now, if you don't have a source of sustenance, if you are solely dependent on your partner, if you are doing boy and girlfriend relationship, please don't go into bringing babies forth. Babies should be desired. Babies should be planned for. It doesn't make sense to bring baby into this world and you are not ready. So in as much as you can easily become pregnant in your 20s, if you are not ready, think contraceptives. Now, the 20s is also the period you can easily pick up a lot of sexually transmitted infections, simply because you are younger, your libido is high, your hormones are all over the place, you are more desirable, everybody wants to hang out with you, you want to hang out with everybody. That's when you fall in love, that's when you start dating, that's when you marry, that's when your friends will start married. So it's not unusual to see so many women in their 20s getting married, dating, proposing, doing all that, thinking about life. But you have to be ready. You should not be solely dependent on the male partner regarding starting your family. Having a baby is something you need to desire and you need to be ready, because there are so many adjustments. Your emotions are going to change, because pregnancy is no longer going to be the person you used to be, because the pregnancy hormones and all the hormones that will help you to become a woman will change you. And if you're not strong, you might be prone to depression, you might be prone to anxiety, you might be prone to mood disorders, you might be prone to a couple of things. Also, in your 20s is when you are less careful. So women in their 20s might tend to experiment with drugs, with alcohol, with smoking, with lack of exercise and all that. So you have a very high risk of exposing your pregnancy if you're in your 20s, if you're not educated. You also have a very high risk of picking up sexually transmitted infections, two of which can affect the outcome of your pregnancy: chlamydia and gonorrhea. There are so many women that might be in their 20s. They might have UTI, urinary tract infections. They can have candida, which is not a sexually transmitted infections. You can have all the gamut of sexually transmitted infections, from viral to bacterial to parasitic. This is the period you need to be very careful, because the mistake you make in your 20s can affect you in your 30s, can affect you in your 40s, and can affect your fertility. So if you are engaging in sexual practices in your 20s, know this: one of the consequences of not using protection is pregnancy. The second one is sexually transmitted infections. Both of them can change your life. Both of them can change your career. Both of them can change your family. Both of them can either help or harm you. So you need to be well ready. You need to have good rapport with whoever you're hanging out with. You need to be careful, because one night can change your life. Just a mistake can change your life. Just one night. Even non-penetrative sex can lead to pregnancy. So there are so many things you need to be conversant with if you're in your 20s, because your body is going to change. Your breast will start developing, your hips will start developing, you will start looking more beautiful, people will desire you, and most people won't even know you're in their 20s. They will think you're so developed. So this is a period you should be very, very careful. This is also a period you should exercise and eat good food and sleep. Unfortunately, in our society, if you're a student, if you happen to be in a professional discipline, sleep is going to be one of your worst enemies. Why? Because you will see your sleep pattern messed up. I remember when we were in medical school, we rarely sleep. We stay up late night to read and do all that. If you are in this age, the level of your stress will be up, but you can handle it because you're younger. So you need to engage in positive lifestyle, exercise, don't drink alcohol, definitely don't smoke, don't use recreational drugs, drink a lot of water, sleep when you can. If you can do this, you are shoring up your body. You are getting your body ready for when you will eventually become pregnant, because your body is your body when you become pregnant. How healthy your body is when you become pregnant will predict how your baby will be. So if you have a healthy body, the possibility your pregnancy will go smoothly is high. The possibility you have less complication is high. The possibility you'll blink and you have all your baby is high. Now, if you are blessed and you are in your early 20s, if you want to have 3 kids, space them out. So assuming you have your first kid in 22, please don't have the next one in 23. Have the other one in 25. So if you have a baby in your 20s, and I'm giving numbers, 23, your first baby was 23, please don't have the second one at 23, 24. Have it near 25, 26. Do you know why? If you allow 18 months to pass before becoming pregnant again, your body will recover. You will become more matured. You will have more education. You'll be more independent to look after another baby. You cannot have so many babies together about the same age in your 20s. It's going to change your life forever. So plan your pregnancies. Give 18 months gap because you can become pregnant. You are not rushing anywhere. If you were above 35, I can understand. But if you're below 35, plan your pregnancy. Space them out. 18 months gap. Very important. Now, another point you have to remember. In your 20s, you're so carefree. You're so careless. You might not remember to do the important things. You might not be eating right. You might be eating fried foods. You might be eating highly processed food. You might not be getting adequate nutrient and multivitamins you will use as a woman. So you must be very careful. If you are meeting with your partner, make sure you take your prenatal multivitamins daily, because one of the consequences of making love is pregnancy. So some women about their 20s can actually become pregnant, and they wouldn't even know they're pregnant until they've gone into second trimester. But the earlier you know you're pregnant, the better you're going to seek the help you need, and you'll be more careful. So in summary, your period around 20, the best time to be pregnant, less complication, more productive, good eggs, good quality, high libido, expectations all over the place. But you have a disadvantage because you are less matured. You might not have enough money. You must still be living with your parents. You must still be a student. You must still not have a lot of good experience. You might have just suffered your first heartbreak. You might not be able to take decisions by yourself. You must still be a daddy's girl. And it doesn't make sense for babies to have babies. The problem we have in our society today is because babies are having babies. Adults are meant to have babies, not babies having babies. When babies have babies, nobody can look after each other. Okay, so I'm going to open the clinic. And I'm going to give you an opportunity to ask your question. It's not your regular butter and bread, but this is a topic I want us to talk more about. So please, when you come in, start asking your questions so I can provide you feedbacks. Do you have any questions? Feel free to ask your questions. Let me see. For some reasons, the chat section is not showing anybody in attendance. Can you guys all see me? Can you all hear me? If you can you participate, please? Just type your name. I'm trying to say hello to people in attendance. I can see about 4 people are in attendance, but I'm not seeing any chat messages. Can you all come forth so we can talk? It's time for questions. Let me see if my admin is trying. Sometimes we have, let's see. Okay. Do you have any questions, please? Oh, wow. So you guys can see me. You guys can see the chat, but for some reasons, I'm not seeing anybody's question. For some strange reason. So I don't know what's going on. I would have loved to provide you feedbacks. Can you ask your questions if you can? Is it possible? I don't know if we are having problems. Participants. For some reasons, I can't see any question. Let me refresh. Hold on, guys.